Hi, welcome. This is Crow Song Yoga Therapy and I'm Christine. Welcome to the Yoga Nest. Today we're going to do a little bit of movement and care for our low back. Sometimes we wake up in the morning and we have stiffness or tightness. Sometimes there's downright pain there, so it can be quite unpleasant. We're going to use a few props today. We have a chip foam that can be nice under your head, under your sacrum. The slow-mo ball, which is a deflated Pilates ball. A Siamese cat is always helpful. The nice thing about a slow-mo ball is we can inflate it or deflate it for comfort, your choice. I like mine quite deflated when it's underneath my sacrum, so I'm just checking. Siamese cats really seem to like the chip foam. Also, we have a couple of soft massage balls for some myofascial release that we're going to do, and also a 4-inch block that you might appreciate using as well. So let's get started. We're gonna start on our backs today. I'm also going to grab my booster here, because sometimes when our low back is sore, it can be really supportive and feel quite nice to have the bolster at our knees. Try it out, explore a little bit. You decide what you want to do today. So I invite you just to come onto your mat and lay down on your back. We're going to start with a little bit of constructive rest in a supine position. Coming down onto our back with our knees bent. Again, you may have your bolster placed at your knees or upper thighs. I'm not going to use mine today, as it's just getting a little in the way. Just stretch out first and then float my feet up and put my feet just near my sits bones, in line with my sits bones. You can see there's a good amount of space between my heels and my glutes. Let's just take a moment, come in to this present moment, connect with your body in connection with the floor, and decide, do you want to add a little bit of comfort, or where can we add a little bit of comfort? I'm going to take the chip foam ball and just place it under my head. Give my head a slight lift. And I'm going to take the slow-mo ball and putting a little bit of pressure into my heels and dragging my heels energetically along the floor, lifting my glutes up and placing the slow-mo ball right at my sacrum. And then settling in here again, I invite you to think about where you want to place your hands. Right now, I'm just feeling comfortable having my hands placed on my lower abdomen, and this can be supportive with breath. It helps me to come into my body, into this space. Now, breathing out, exhale. Low ribs along the bottom of the floor, slight curve in my low spine, and feeling that connection of my toes, heels on the mat. I have a carpet on my mat, so I can feel the texture of that towel. Feeling my sacrum floating on the slow-mo ball, which gives me a little bit of mobility. My lower ribs connecting with the floor, and then the mid-back, the shoulders, and the back of the head comfortably placed on the chip foam block. Centering here. Letting your body be heavy. Allowing the gravity to hold you. And now, let's begin with some diaphragmatic breath. Diaphragmatic breath really helps us to use our diaphragm to breathe. So I'm going to take my hands and place them just on the sides of my rib cage. And as I inhale, I'm going to bring awareness to the movement of my ribs. You might experience your rib cage moving into your hands on the inhale. And as you exhale, you may become aware that your rib cage knits together and draws in. Inhale. And on the exhale, see if you can notice a slight lift in the pelvic floor. Inhaling, ribs into hands. Exhaling, belly drops, pelvic floor lifts. Inhale, ribs into hands as your air fills your lungs. Exhale as the pelvic floor lightly lifts and the belly drops, pushing out the air from your lungs. Inhale and exhale. Now I'm going to leave you for a moment to do 1, 2, 3 more breaths just like that. And bring some awareness as we continue with this breath. You might notice a release of energy, or letting go. From my experience, this breathing, it really helps bring my pelvis into a neutral position. And it takes a lot of tension out of my low back. Now I invite you to move your hands to your center, continuing with your breath. Noting the inhale and the exhale. You might bring a smile to your face at the exhale. And now start to gently tilt our pelvis. Dropping it forward into anterior pelvic tilt and curling it under in posterior pelvic tilt with your inhale. As we're breathing, inhaling